Have you ever paused to consider how the very core beliefs you hold about your own abilities, or perhaps those of your colleagues, silently dictate nearly every choice you make in your professional life? In the demanding, ever evolving landscape of medicine, where continuous growth, adaptation, and, well, an unwavering commitment to improvement are not just ideals, but absolute necessities. It's tough. The relentless pursuit of development can often feel like, an overwhelming burden. But what if the fundamental way we think about our potential is actually the most significant determinant of whether we truly achieve it? Today, we're embarking on a crucial deep dive into precisely that question. We're exploring the profoundly influential work of Carol Dweck, a distinguished professor of psychology at Stanford University and a leading expert in motivation and personality. We're looking through the lens of her seminal book, Mindset: The New Psychology of Success. Dweck's research, honed over more than 2 decades, has truly reshaped our understanding of what fundamentally drives us, what unexpectedly holds us back, and most importantly, how we can unlock our fullest capabilities, not just as individuals, but, well, as an entire profession.
It's fascinating, really. What's truly remarkable about the mindset framework is that it provides this powerful lens through which to understand precisely how these deeply ingrained beliefs about our talents and inherent abilities, well, how they actively construct our entire mental world. It's far more than just some theoretical concept. It's a living, breathing paradigm. It influences everything, from the ambitions we dare to set for ourselves, to the meticulous work ethic we apply to complex cases, the quality and resilience of our professional relationships, and ultimately, whether we genuinely fulfill our potential within such a demanding and high-stakes profession. For medical professionals, people who are constantly navigating intricate clinical challenges, meticulously absorbing new research findings, and ceaselessly adapting to evolving clinical guidelines. This framework offers not just insight, but crucial, actionable strategies for fostering profound resilience and cultivating a genuine lifelong commitment to learning. It's incredibly relevant.
Absolutely. We've all seen it, haven't we? Maybe two highly capable medical students tackling the exact same complex diagnostic case. One seems to relish every puzzle, viewing each struggle as, a vital step towards mastery. The other hesitates, visibly fearing a misstep might expose some hidden flaw or a perceived lack of inherent ability. What's truly driving that fundamental difference in approach? Carol Dweck would argue it comes down to two distinct belief systems or mindsets that shape everything. Let's really unpack what these are at their core.
That's an excellent observation, yes. And it cuts straight to the heart of Dweck's framework, really. At its essence, her work delineates two distinct belief systems that profoundly shape how we approach every aspect of our lives, from the seemingly trivial to the most significant challenges and opportunities. So the first is what she terms the fixed mindset. Now, if you operate predominantly with a fixed mindset, you fundamentally believe that your talents, your intelligence, your innate abilities, they're all predetermined static traits. It's as if they were inscribed at birth, set in stone. You either inherently possess them or you simply don't. And this deeply held conviction, well, it often leads to a constant, almost subconscious need to prove oneself. Individuals with this mindset feel compelled to continuously demonstrate their existing smartness or talent at all costs. They frequently shy away from situations where they might appear less than perfect, less than entirely competent, because any perceived failure or even a moment of struggle could be seen as a direct indictment of their inherent unchangeable ability.
Right, so failure feels incredibly personal and, well, final almost.
Yes, exactly. Dweck quite vividly describes this as the path of stagnation. It's a perpetual, often exhausting state of attempting to validate what you already believe you intrinsically are, rather than exploring what you could become. For a doctor, this might manifest as, say, sticking strictly to familiar procedures, even if newer, more effective ones emerge, simply to avoid the learning curve where they might feel less proficient initially. That perceived vulnerability is just too threatening.
Okay, and the alternative.
The alternative is, in profound contrast, the growth mindset. This perspective is built on the liberating understanding that talents and abilities are not fixed endowments, handed down like some immutable decree. Instead, they are dynamic. They can be developed, nurtured, and significantly cultivated over time. Through dedicated effort, continuous learning, and a profound willingness to embrace challenges. Great abilities, whether it's mastering the intricate hand-eye coordination required for complex microsurgical techniques or excelling in the nuanced art of diagnostic reasoning under pressure. They are not born, but meticulously built. Through persistent effort, a hunger for learning, and the resilience to bounce back from setbacks.
So effort is key here, not a sign of weakness.
Absolutely essential. This mindset views effort not as a sign of inadequacy, but as the very mechanism through which genuine growth occurs. It's about becoming, perpetually transforming, rather than simply being a static entity. This, Dweck asserts, is the path of opportunity and success. It fundamentally liberates individuals to eagerly embrace challenges, extract invaluable lessons from setbacks, and continuously evolve their capabilities. Imagine a clinician in a growth mindset, not only embracing a challenging new piece of research, but actively seeking opportunities to implement and refine it, understanding that the initial struggle is part of the journey to expertise. That makes a huge difference. It really does. And it's crucial to understand that this isn't merely some minor personality quirk or a fleeting preference or even just a superficial attitude we can switch on and off. It is, in fact, a deeply ingrained belief system that profoundly shapes an individual's entire mental world. It dictates with surprising accuracy how one perceives challenges. Are they threats or opportunities? How one interprets setbacks. Are they failures or feedback? And how one fundamentally responds to constructive criticism. This foundational belief then goes on to predict an individual's approach to virtually everything they encounter, making it an absolutely critical area of understanding, especially in professions like medicine that demand constant evolution, peak performance, and, well, an unwavering commitment to patient care. It underscores how deeply our internal narratives dictate our external realities.
What I find so compelling, and you touched on this, is how Dweck shows these mindsets aren't confined to learning environments or the classroom. They seem to seep into everything. Where else do they really permeate? How do they influence our professional lives, our relationships, or even how we mentor others within a demanding medical environment?
Oh, the reach of mindset is truly comprehensive, yes. It extends far beyond the immediate context of learning new facts or skills. A person's dominant mindset doesn't just subtly influence their approach to academic learning, it fundamentally shapes their life goals, their deepest attitude towards demanding work, and critically, how they navigate their professional relationships and their personal bonds. It's everywhere.
Can you give an example, perhaps in a medical context?
Certainly. Let's consider a practical example within medicine. How a seasoned physician with predominantly fixed mindset might approach a new, paradigm-shifting research paper. Maybe it details a novel treatment protocol that contradicts years of their established practice. They might feel intense pressure to immediately understand it perfectly, or worse, dismiss it outright if it challenges their established knowledge, fearing that grappling with new, unfamiliar information might expose a perceived gap in their expertise or outdated methods.
So the fear is about looking less competent.
Precisely. This can tragically lead to a reluctance to truly engage with essential continuing professional development if it means admitting there's still more to learn or that their current well-honed methods aren't exhaustive. The drive here is to protect a perception of already being the expert rather than becoming a continuously evolving one.
And the growth mindset approach.
Well, conversely, a medical professional with a growth mindset would greet that same revolutionary research paper as an invaluable opportunity, an opportunity for deep, personal, and professional development. They would eagerly embrace the intellectual challenge of understanding it, knowing intuitively that the concentrated effort involved directly contributes to expanding their capabilities and enhancing their patient care. This mindset consistently predicts whether or not individuals will genuinely fulfill their potential, adapting fluidly and effectively to the dynamic demands of their profession. Whether it's mastering a new, minimally invasive surgical innovation, adopting an entirely new diagnostic algorithm, or simply refining their patient communication strategies to be more empathetic and effective. It's about being fundamentally responsive and proactively evolving their practice, rather than resting on the laurels of perceived innate talent or past achievements.
That adaptability seems crucial in medicine.
Absolutely vital. Yesterday's best practice can quickly become tomorrow's outdated approach. You have to keep moving. Moreover, this influence isn't limited to a specific stage of a medical career. Dweck's work highlights that mindset unfolds and profoundly impacts individuals throughout childhood and adulthood, driving behavior and decision-making in diverse contexts, from early career progression and assuming leadership roles to personal development and, critically, how we mentor junior colleagues.
How does it affect mentorship specifically?
Well, for instance, a growth-minded mentor in medicine wouldn't just praise a mentee for making an intelligent diagnosis, Instead, they would meticulously focus on praising the rigorous effort, the systematic strategic thinking, and the persistent curiosity their mentee applied to a difficult case, even if the initial diagnosis was not perfectly correct.
So praising the process, not just the outcome or the person's inherent smartness.
Exactly. This subtle yet powerful shift in feedback helps to cultivate a similar growth orientation in the mentee, encouraging them to view complex challenges as rich opportunities for deep development, rather than anxiety-inducing tests of inherent ability. This approach is instrumental in fostering a vibrant culture of continuous improvement and psychological safety, which is absolutely vital in a field where knowledge and best practices are constantly advancing and the stakes are consistently high.
So we've outlined these mindsets, fixed versus growth. But here's where it gets truly transformative, I think, particularly in the demanding world of medicine. How does this fundamental belief system redefine something as central as success itself? Is it about continually mastering new frontiers or perpetually proving an innate intelligence and capability?
That's a profound question, yes. And the distinction here is indeed central to Dweck's argument. It really changes the game. For an individual operating primarily with a fixed mindset, success is predominantly about demonstrating existing intelligence or an inherent, unchangeable talent. It's about proving to oneself and to others that you are already smart, already skilled, already competent. This perspective often leads to a significant reluctance to undertake truly challenging tasks. For example, a seasoned surgeon might resist attempting a complex and novel surgical technique that's still being refined, or a diagnostic radiologist might shy away from taking on particularly intricate, ambiguous imaging puzzles that push the boundaries of current knowledge and require significant deductive reasoning.
Because failure would undermine that already competent image.
Precisely. The underlying fear of potential failure in such scenarios is immense, because it could expose a perceived lack of inherent ability, which, in a fixed mindset, feels like a permanent public condemnation. The definition of success here isn't in the learning or the journey, but purely in the flawless performance and the immediate validation that comes with it.
And for the growth mindset, how does success look different there?
Well, for those with a deeply embedded growth mindset, success is intrinsically and beautifully linked to continuous learning, to profound personal growth, and to the tireless mastery of new skills. Here, a challenge isn't perceived as a threat to one's inherent competence. It is seen, rather, as an essential and exciting opportunity for deep development and a more comprehensive understanding. Consider a clinician who needs to learn a complex new surgical technique, perhaps one involving robotic assistance, or a novel pharmacological approach for a rare condition. A fixed mindset might cause them to avoid the initial difficulties, perhaps sticking to familiar, less effective methods to avoid the risk of appearing clumsy or less capable during the learning phase. But a growth mindset would eagerly embrace those initial struggles, the awkwardness of unfamiliar controls, the need for repeated practice in a simulated environment, the requirement for extensive supervision, as a necessary and invaluable part of acquiring true, cutting-edge expertise. Success, from this growth perspective, is fundamentally the iterative process of expanding one's capabilities, not merely showcasing what one already definitively knows or can flawlessly execute. It's about the journey of becoming more, not just the state of being.
Failure, or perhaps more accurately, the inevitable setbacks, are an undeniable part of any demanding professional journey. And nowhere is that more acutely felt than in healthcare, where the stakes are undeniably high. How do these distinct mindsets fundamentally alter how we perceive and react to these often unavoidable challenges?
The way we frame and internalize failure. It's arguably one of the most powerful and differentiating characteristics between the two mindsets. It's critical. For the fixed mindset, failure is frequently interpreted as a direct, deeply personal, and often permanent indictment of one's innate ability or intelligence. It's not merely a setback. It's internalized as a permanent, often humiliating label. If a complex diagnosis is unfortunately missed, or a meticulously planned treatment regimen doesn't yield the expected positive outcome, a fixed mindset might tragically lead to an overwhelming sense of personal inadequacy, profound shame, or even despair.
Which must be incredibly debilitating.
It can be, and this can then manifest in highly detrimental ways. Defensiveness, a tendency to deflect blame onto external factors or colleagues, or a complete psychological disengagement from similar future challenges, all in a desperate attempt to protect the fragile perception of inherent, unblemished competence. The psychological cost here is immense, potentially stifling crucial self-reflection.
So how does the growth mindset handle failure differently?
Completely differently. For the growth mindset, failure is entirely reframed. It is emphatically not viewed as an end state or definitive judgment of personal worth. Instead, it is perceived as invaluable information, a crucial and often painful stepping stone for profound improvement, and an invaluable opportunity to refine strategies, adjust approaches, and deepen understanding. If a new surgical approach, meticulously planned, doesn't work as anticipated, a growth-minded surgeon wouldn't interpret it as a personal failing, not at all. Instead, they would rigorously analyze it as a vital data point, an opportunity to meticulously review what went wrong, adapt their technique, consult with peers for different perspectives, and critically learn for the next time.
So it becomes data for improvement, not a judgment.
Exactly. Failure, from this empowering perspective, is perceived as a natural, constructive, and absolutely essential part of the continuous learning and development process. Especially in a dynamic field like medicine where absolute certainty is rare and continuous adaptation to complexity is an unyielding necessity. This reframing is absolutely critical for building authentic resilience within healthcare. Given the high-pressure environment, the inherent uncertainties, and the constant, often unrealistic demands for perfection, the capacity to learn from setbacks rather than being psychologically crippled by them is paramount, both for individual well-being and systemic improvement.
It sounds like it would foster innovation, too.
It robustly fosters innovation, yes, because it actively encourages recent experimentation. It understands implicitly that not every new idea or approach will succeed, but every sincere attempt yields invaluable, often surprising, information. Ultimately, it vigorously promotes continuous progress, ensuring that medical professionals and the intricate systems they operate within are always evolving towards better patient care, more effective practices, and ultimately a safer healthcare landscape.
And what about effort? We talked about its importance in the growth mindset, but how do these mindsets shape our view of hard work itself, especially in a profession demanding relentless dedication and long hours?
Yes, the perception of effort is particularly insightful and often counterintuitive for those operating primarily with a fixed mindset. In that perspective, consistent, sustained effort can paradoxically be viewed as a definitive sign of weakness or a deficiency in natural inherent ability.
Really, effort is a bad thing.
It sounds odd, but yes. The underlying unspoken belief is that if one were truly talented or genuinely brilliant, if they were blessed with that innate gift and sustained, visible effort shouldn't really be necessary. It's almost as if having to overtly work hard implies you're simply not naturally gifted enough to achieve success effortlessly. So you might observe a fixed mindset medical student avoid putting in the extra, grueling hours for a difficult anatomy exam, because if they struggle despite the effort, it might tragically confirm their deepest fear that they're simply not smart enough to be a doctor. There's this pervasive belief that true talent should just flow effortlessly. Wow. Okay, so the growth mindset view of effort, completely the opposite. For the deeply ingrained growth mindset, effort is seen as absolutely essential, indeed foundational. It's not just a means to an end. It's the fundamental, indispensable mechanism for developing abilities, expanding expertise, and achieving genuine mastery. It is, quite simply, the direct, unwavering pathway to unlocking and truly fulfilling one's vast potential. A growth-minded professional intrinsically understands that genuine expertise in medicine, from the diagnostic acumen of a seasoned neurologist to the surgical precision of a leading cardiac surgeon, is meticulously cultivated through countless hours of rigorous study, painstaking practice, and relentless, persistent application. They would view those demanding long shifts, the continuous and exhaustive reading of cutting-edge journals, and the tireless pursuit of improved patient outcomes not as a burden, not as a sign of personal inadequacy, but as the very profound process of becoming increasingly capable, increasingly proficient, and ultimately increasingly impactful.
The implications for burnout must be huge.
Profound and far-reaching, particularly within a high-pressure and often emotionally taxing environment like medicine. A fixed mindset's detrimental view of effort could easily contribute to severe burnout, as sustained hard work might feel like an endless, futile struggle against innate, unchangeable limitations, rather than a productive, empowering journey of growth and achievement. It might also tragically lead to individuals shying away from challenging leadership roles, pioneering research opportunities, or highly specialized areas of practice that demand significant, sustained time and unwavering dedication.
Whereas the growth mindset.
Conversely, the growth mindset's robust embrace of effort actively fosters sustained professional persistence. It empowers medical staff to not just manage demanding workloads, but to thrive within them, viewing them as invaluable opportunities to continuously hone their skills, deepen their knowledge, and contribute meaningfully to complex patient care, rather than as an exhausting drain on a finite, static pool of talent. This perspective is absolutely vital for long-term career satisfaction, for preventing professional stagnation, and for fostering a truly resilient, continuously evolving healthcare workforce.
Now, Dweck introduces a concept about praise that I think many of our listeners, especially those in leadership or teaching roles within medicine, might find quite surprising. Even counterintuitive. We're often encouraged to commend individuals for being smart or brilliant, yet her research presents a very different perspective. Could you elaborate on why this kind of seemingly positive praise might inadvertently hinder growth, particularly in developing medical professionals?
Yes, you've hit on a truly crucial and often perplexing point that challenges deeply ingrained conventional wisdom. It's really important. Dweck's rigorous research demonstrates that praising inherent intelligence or innate talent statements such as, "You're so clever you solved that diagnostic puzzle instantly," or "You're a brilliant surgeon, your hands are truly gifted," can, quite ironically, inadvertently cultivate a fixed mindset.
How so? It seems like encouragement.
Well, the moment an individual internalizes that their success, their value, or their praise is inextricably linked to an inherent fixed quality they supposedly possess, they become acutely aware of an intense, often unspoken pressure to maintain and constantly validate that smart or brilliant label. They begin to operate under the immense psychological burden of having to perpetually prove their intrinsic smartness or brilliance, rather than focusing on the learning process itself.
So the focus shifts from learning to performing to protecting the label.
Precisely. And what inevitably happens then, individuals praised in this manner can become incredibly risk-averse. They become less willing, sometimes even overtly fearful, to tackle challenging tasks precisely because they anticipate and dread the possibility of making mistakes. A mistake within this fixed mindset framework could be catastrophically interpreted as invalidating their precious smart label. Why risk proving you're not as clever or brilliant as everyone thinks if you can simply stick rigidly to what you know you're already good at, performing safely within your established comfort zone?
Which is the opposite of what you need in medicine.
Absolutely. This dynamic can be particularly detrimental in medical training and ongoing professional development, where experimentation, learning from errors, and consistently stepping outside one's comfort zone are not just beneficial, but absolutely essential for achieving true mastery and adapting to new frontiers. It's not just an academic point, the consequences can be profound. Dweck even references earlier work, noting that it's not unusual for children who are praised for being smart to become less likely to take on challenging learning tasks.
Well,
This vital principle extends seamlessly and powerfully into adulthood and every aspect of professional life, shaping career trajectories and the willingness to innovate.
so what's the alternative? How should feedback be given?
Consider the very real implications for how feedback and crucial encouragement are imparted to medical students, junior doctors, or even established colleagues within a teaching hospital. If a senior consultant consistently tells a junior, "You're naturally gifted at diagnostics, you just have that innate clinical eye," that junior might, perhaps unconsciously, avoid truly complex or ambiguous cases where they might struggle solely to protect that gifted image. However, if the feedback is instead meticulously focused on acknowledging and praising the rigorous process, the dedicated effort, the strategic thinking, and the sheer resilience demonstrated. For example, saying, "That was an incredibly thorough and well-reasoned clinical assessment. Your meticulous dedication to patient history and differential diagnosis really paid off, even when initial signs were misleading."
Oh, okay.
Well, that actively cultivates a robust growth mindset. This latter kind of feedback encourages them to eagerly embrace future challenges, knowing that their effort, their strategic approach, and their perseverance are what truly lead to mastery and improvement, not just some inherent static talent. It's fundamentally about celebrating the profound journey of learning, the process of becoming more, not just the fleeting destination of a correct answer.
That makes incredible sense. And conversely, if positive labels can be problematic, what about the impact of negative labels? How do they function within these mindset frameworks, and what are the profound consequences, especially in a demanding professional context like medicine?
Yes, the impact of negative labels can be equally, if not more, profoundly damaging than the problematic positive ones. Precisely because they powerfully reinforce a fixed mindset about one's perceived limitations. When someone is labeled, or indeed tragically labels themselves, with a perceived deficiency, for example, an internalized belief like, "I'm simply not good at complex diagnostics," after an early career misdiagnosis, or "I lack the inherent surgical dexterity for intricate procedures," or even if it's an unspoken internalization from a critical piece of early feedback. They often, and quite understandably, cease to exert genuine effort or actively seek improvement in that specific area.
Why? Because they believe it's futile.
Exactly. From a fixed mindset perspective, if you are innately not good at something, if it's a fundamental, unchangeable part of who you are, then any amount of effort is perceived as futile. It cannot possibly change what's seen as an immutable permanent deficit. Why bother if you believe it's destined to fail anyway?
And the consequences for professional growth.
Truly profound and far-reaching implications. For professional growth, innovation, and even patient safety in medicine. Such self-labels, or indeed explicit or implicit labels, applied by mentors, superiors, or even peers, can significantly curtail a medical professional's willingness to step outside their predefined comfort zone. A doctor who rigidly believes they are not a research person might never engage with groundbreaking clinical trials or contribute to vital scientific literature, regardless of their inherent curiosity or capacity to contribute. A surgeon who was once perhaps told, even subtly, they are lacking in dexterity for a specific type of procedure, might never attempt more intricate, evolving techniques, even if their foundational skills have dramatically improved with years of practice. These deeply internalized labels can tragically prevent individuals from undertaking new specialties, engaging with unfamiliar or ambiguous clinical challenges, or even collaborating effectively across disciplines, simply because they internalize a static, limiting view of their own capabilities.
Creating self-imposed ceilings.
Exactly. The tragic consequence is not just individual professional stagnation, but potentially missed opportunities for profound innovation, improved patient outcomes, and a richer, more diverse contribution within the broader medical field.
Dweck masterfully extends these powerful ideas beyond the individual, the intricate dynamics of the corporate world, offering truly profound insights into leadership effectiveness and the prevailing culture within large organizations. What does her rigorous research reveal about the pervasive impact of mindsets in a professional setting, like a hospital or a large healthcare system?
Yes. When we meticulously examine the inner workings of organizations, it becomes strikingly clear that the leader's dominant mindset often permeates, shapes, and fundamentally defines the entire cultural fabric. It sets the tone. Fixed mindset leaders, as Dweck's comprehensive research vividly reveals, often disproportionately prioritize proving their own individual brilliance, their inherent superiority, and their unassailable competence. They might genuinely believe that they possess all the definitive answers, and that their primary role is to demonstrably showcase their innate genius. This often leads them to cultivate professional environments that actively and subtly discourage dissent, where questioning the leader's decisions is not only frowned upon, but seen as a direct challenge to their authority or intelligence, rather than a constructive contribution to problem solving.
Surrounding themselves with yes men.
That's the phrase often used, yes. Individuals who uncritically reinforce their perceived intelligence and assiduously avoid challenging their views or offering alternative perspectives. Crucially, they view mistakes, whether their own or those of their dedicated team, as intensely personal failures rather than invaluable, often painful, learning opportunities that can drive systemic improvement. The book even mentions Enron as a cautionary tale of this talent mindset gone spectacularly awry.
Right. So how do growth mindset leaders differ?
Sharply different. Growth mindset leaders focus relentlessly, passionately, and authentically on developing not just themselves, but their entire team and indeed the entire organization. They possess an intrinsic understanding that talent is emphatically not a finite fixed resource, but something that is meticulously cultivated, diligently nurtured, and continuously expanded through sustained effort, collaborative learning, and shared commitment. They actively value deep learning, rigorously solicit open and honest feedback, even when it's critical or uncomfortable, seeing it as absolutely essential for collective growth and continuous improvement. They actively foster resilience within their teams, encouraging individuals to extract profound lessons from setbacks rather than being permanently defined or crippled by them.
So leadership is about enabling growth in others.
Precisely. For them, true, impactful leadership isn't about being the smartest or most infallible person in the room. It's profoundly about creating an empowering environment where everyone, regardless of their current level of expertise, can become smarter, more capable, and more innovative through continuous effort, mutual support, and shared learning. Dweck also draws a crucial distinction between groupthink and we think.
Explain that difference.
Groupthink is often depressingly prevalent in fixed mindset environments, particularly hierarchical ones where conformity is prioritized over genuine critical inquiry. Individuals often suppress their own legitimate doubts, innovative ideas, or even vital safety concerns to maintain harmony, avoid conflict, or simply to avoid displeasing the perceived leader.
Dangerous in healthcare.
Extremely. In stark contrast, we think is the defining characteristic of high-performing growth mindset teams. Here, diverse perspectives are not just passively tolerated, but actively and vigorously encouraged for robust problem-solving, genuine innovation, and comprehensive risk mitigation. It's about harnessing collective intelligence, where the shared belief in continuous growth and the value of diverse input leads to demonstrably better outcomes and a much stronger, more adaptive team. This powerful framework also speaks directly to that age-old question: are effective leaders born or made?
And the growth mindset answer.
It unequivocally supports the compelling notion that truly effective leaders are overwhelmingly made through continuous development, adaptive learning, and profound, unwavering commitment to nurturing the potential of their teams. It's not about inheriting some preordained leadership quality, but about a lifelong journey of learning, adapting, empowering others, and embodying a culture of continuous improvement.
This is incredibly relevant to our medical audience. How do these leadership principles directly translate to hospital management, the nuanced dynamics of clinical department leadership, or even the crucial interactions within multidisciplinary team meetings? And what are the crucial implications for something as fundamental as patient safety, innovation in healthcare delivery, and maintaining high morale amongst dedicated medical staff?
The translation is not just direct, but profoundly impactful, yes. Imagine a hospital CEO or a clinical director operating predominantly with a fixed mindset. They might rely heavily and exclusively on their own established expertise and past successes, perhaps resisting the adoption of new evidence-based practices that challenge their long-held beliefs. Simply because it means admitting a different, possibly better way exists. They might become defensive if patient outcomes are not perfect, perhaps hastily blaming individual staff members rather than rigorously looking at systemic issues or opportunities for critical process improvement.
Which stifles learning and safety.
Absolutely. This mindset can tragically stifle vital innovation, lead to a pervasive culture of fear where mistakes are hidden rather than openly learned from, and ultimately profoundly compromise patient safety. It could also lead to a rigid top-down hierarchy where junior staff, despite their close patient contact and fresh perspectives, feel utterly unable to voice concerns, suggest improvements, or challenge established, potentially outdated practices. Which is particularly perilous in high-stakes, rapidly evolving environments like an emergency department or intensive care unit.
And the growth mindset leader in that context.
Conversely, a growth mindset leader in a medical setting would actively and deliberately foster a vibrant culture of continuous learning, psychological safety, and open discourse. They would explicitly encourage staff to openly discuss complications, near misses, and even outright failures not as individual failings to be punished, but as collective learning opportunities to be dissected and understood. They would actively invest in cutting-edge training, robustly support groundbreaking research, and meticulously solicit feedback from all levels of staff, from the most junior trainee to the most senior consultant, understanding that everyone has inherent potential to grow and contribute to better patient care. This approach fosters a genuine "we think" culture within operating theaters, during complex patient care discussions in a multidisciplinary team meeting, or even in the collaborative development of new clinical pathways.
So it unlocks the team's potential.
Exactly. When everyone feels safe, empowered, and encouraged to contribute their unique perspective, to learn from mistakes, and to challenge assumptions, it leads to demonstrably robust problem-solving, truly innovative healthcare delivery, and significantly enhanced patient safety. It also directly contributes to demonstrably higher staff morale, as individuals feel genuinely valued for their contributions, their insights, and their immense potential for growth, rather than just being judged solely on static performance metrics. It fundamentally shifts the focus from a punitive blame culture to one of continuous collaborative improvement, which is essential.
The insights from mindset even extend to our relationships, both deeply personal and profoundly professional. How do these core dynamics manifest in our interactions with colleagues, our mentors, and perhaps most crucially, our patients?
It's true. The principles are remarkably pervasive. They touch every facet of our human interactions. In professional relationships, a fixed mindset can unfortunately lead to viewing a valued colleague, a fellow researcher, or even a promising mentee as a direct rival, a potential source of unflattering judgment, or even an enemy if their success or perceived competence is interpreted as somehow diminishing one's own standing or perceived brilliance.
Leading to unhealthy competition.
Intense and often unhealthy competition, yes, where individuals are constantly trying to implicitly or explicitly determine who's the greatest doctor in this department, or who's more competent in this surgical subspecialty. This can be particularly problematic and even dangerous in a medical team, leading to a profound reluctance to genuinely collaborate, to openly share hard-won knowledge, or to provide authentic, selfless support if it might, in their perception, elevate another's status or expertise at their own expense. There can also be a subconscious belief that a truly strong professional relationship, much like a personal one, shouldn't require sustained effort, uncomfortable honesty, or difficult, frank conversations. If conflict or disagreement arises, it might be tragically seen as a fundamental, irreconcilable incompatibility, rather than a valuable opportunity for mutual growth, deeper understanding, and strengthening connections.
Okay, so how does the growth mindset approach relationships?
Profoundly differently. The growth mindset views all relationships, both professional and deeply personal, as requiring continuous cultivation, dedicated effort, and ongoing development. Like a garden, really. Challenges within professional teams, perhaps a heated disagreement over a complex treatment plan, a miscommunication during a critical patient handover, or a clash of opinions in a multidisciplinary meeting, are seen not as permanent, irreparable flaws in the relationship, but as invaluable opportunities to learn from differing perspectives, to grow individually and collectively, and to strengthen connections collaboratively.
So conflict is an opportunity.
It's about constructively working through difficulties, genuinely understanding different viewpoints, and collaboratively finding innovative ways to improve communication, foster trust, and enhance teamwork. Dweck's work also briefly touches upon how this extends to broader social dynamics, including friendship, shyness, and even how individuals react to conflict, suggesting fixed mindsets can perpetuate negative cycles.
Bringing this back to healthcare, how does this play out daily?
We'll think about the intricate team dynamics within a hospital ward or a surgical theater. A fixed mindset might tragically foster isolation, individualistic practice, and a reluctance to seek or offer help, seeing it as a sign of weakness. Whereas a growth mindset actively promotes a truly collaborative, mutually supportive environment where nurses, doctors, allied health professionals, and administrative staff actively learn from each other's expertise and experiences. In mentor-mentee relationships during rigorous medical training, a growth mindset on both sides encourages open, honest dialogue, courageous constructive feedback, and a shared, unwavering commitment to the mentee's holistic development, seeing genuine mistakes as profound learning opportunities rather than immediate reasons for dismissal or judgment.
And the patient-doctor relationship.
Crucially, and perhaps most importantly, it profoundly impacts the quality of rapport between patient and doctor. A medical professional with a growth mindset would continuously and empathetically adapt their communication style based on explicit and implicit patient feedback, actively learn from diverse patient experiences and cultural contexts, and proactively nurture their professional relationships across the entire healthcare team. This continuous, dedicated effort in relationships, seeing them as dynamic, evolving, and infinitely capable of growth, directly leads to significantly improved collaborative care, enhanced patient satisfaction, and ultimately, demonstrably better patient outcomes.
So if these mindsets are so fundamental to shaping our professional and personal trajectories, where do they actually originate? And what key messages, particularly from our formative years, contribute most significantly to shaping them into the deeply ingrained beliefs they become?
Yes, it's abundantly clear that mindsets are not something we are inherently born with, like eye color or blood type. Not at all. They are quite powerfully, largely shaped and molded by our immediate environment, and critically, by the explicit and implicit messages we consistently receive from significant figures in our lives. Dweck highlights that parents, dedicated teachers, and influential coaches play an instrumental, often subconscious role in shaping these mindsets, predominantly through the messages they implicitly or explicitly convey about what constitutes success, how to interpret failure, and the very nature of ability. It's often the subtle feedback, the specific ways we are praised or indeed criticized, that leave the most profound and lasting imprint on our developing psychological framework.
Like the smart praise example.
Exactly. If a child is consistently told, "You're so incredibly smart, you got full marks on that challenging test without even having to try very hard," they might, understandably, internalize the insidious idea that intelligence is purely about innate, effortless ability, and that visible effort is somehow a sign of not being smart enough, thereby fostering a fixed mindset. This brings us squarely back to that crucial, often perplexing, counterintuitive point about praise we discussed earlier. It is not unusual for children who are praised for being smart to become less likely to take on challenging learning tasks.
Because they fear losing the smart label.
Precisely. They become acutely afraid of appearing less smart, of shattering that precious smart identity. So the very people who are genuinely meant to foster profound growth and intellectual curiosity can, quite tragically, inadvertently install a fixed mindset, particularly if they focus solely and relentlessly on praising static results or inherent unchangeable traits, rather than meticulously acknowledging and celebrating the sustained effort, the strategic thinking, and the resilience applied. These early formative messages set the fundamental stage for how we view intellectual challenges, interpret the role of effort, and even perceive our own inherent capacity for growth throughout our entire lives and professional careers. They are the seeds, really.
Perhaps the most empowering message, and certainly the one that resonates most deeply with professionals aiming for continuous excellence from Dweck's entire body of work, is that mindsets are emphatically not immutable. She shows us, quite compellingly, how we can actively change our mindset at any stage of life, even mid-career or in senior leadership positions. What does that transformative process entail? And how can busy professionals, particularly those deeply immersed in their medical careers, actively cultivate a growth mindset, especially later in their professional journeys?
Yes, this is truly the most liberating and actionable aspect of Dweck's groundbreaking research, the inherent empowering nature of change. It offers real hope. It is vital, though, to deeply understand that changing one's deeply ingrained mindset isn't a miraculous quick fix, a simple flip of a switch, or a one-off resolution. It is unequivocally a deliberate, sustained, and often challenging process, much akin to mastering a complex new surgical skill or building an entirely new, deeply ingrained habit like daily exercise. It takes work. Dweck's book meticulously describes structured, evidence-based approaches, such as her renowned mindset lectures and interactive workshops, including innovative programs like Brainology, as robust methods for fostering significant and lasting mindset shifts. So it's about learning how the brain works. Partly, yes, these aren't merely motivational talks. They are meticulously designed to genuinely teach individuals about the brain's incredible capacity for neuroplasticity, its profound ability to literally rewire itself through new experiences, dedicated effort, and persistent learning. They equip individuals with the self-awareness and practical tools to recognize, understand, and then consciously challenge their own fixed mindset triggers and narratives in real time.
Are there practical steps individuals can take themselves?
Absolutely. The book also highlights a wealth of implicit, actionable strategies. It suggests practical insights for deeply personal transformation. This means actively and consistently identifying those moments when you feel yourself slipping into a fixed mindset. Perhaps avoiding mastering a new, complex electronic patient record system because you fear looking foolish or inefficient, or dismissively labeling a difficult, ambiguous patient case as too complex or hopeless rather than embracing it as an invaluable learning opportunity to deepen your diagnostic acumen. Once identified, the transformative process involves consciously and deliberately reframing that challenge into a genuine growth opportunity. Meticulously focusing on the iterative learning process and the inherent value of persistent effort, even when it feels uncomfortable.
So embracing the struggle.
Yeah. Fundamentally, yes. It requires a brave willingness to embrace struggle, to push past initial discomfort, and to genuinely see it as an absolutely necessary and productive part of profound improvement and mastery. Dweck also provides honest and insightful perspectives into people who don't want to change, acknowledging with empathy that some individuals find it inherently deeply difficult to shift their perspective.
Why is change so hard for some?
Often it tragically comes down to the deep-seated, fixed mindset belief that admitting the need for change implies a prior, fundamental inadequacy. It's a classic fixed mindset trap. Overcoming this profound psychological inertia requires significant willpower, consistent self-awareness, and relentless tenacity to consciously maintain a newly adopted growth mindset. Particularly when faced with seemingly insurmountable setbacks, internal resistance, or the powerful gravitational pull of old, comfortable habits. It's about consistent self-reflection, intentional practice, and a profound commitment to personal evolution.
How can mid-career or senior medical professionals apply this?
Applying this framework to personal reflection and continuous professional development for mid-senior medical professionals is incredibly powerful. Indeed, transformational. Even the most seasoned consultants with decades of invaluable experience can profoundly benefit from honestly asking themselves, am I truly embracing this new, potentially disruptive research because it challenges my existing knowledge and offers a path to evolution? Or am I subtly avoiding it to protect my current perceived expertise? Or when I give crucial feedback to a junior colleague, am I inadvertently praising their innate cleverness or their diligently applied effort, their strategic thinking, and their remarkable resilience in navigating complexity?
It keeps you learning, regardless of seniority.
Precisely. Cultivating a growth mindset, even at an advanced stage of a medical career, can lead to truly greater innovation in clinical practice, profoundly enhanced resilience when facing adverse patient outcomes or daunting systemic challenges, and ultimately, far greater personal fulfillment and purpose within the dynamic, often stressful and ever-evolving healthcare landscape. It's about viewing every single day as an unparalleled opportunity to learn, to improve, to contribute more effectively, and to inspire those around you, regardless of how many years one has been in practice. It transforms a career into a continuous journey of becoming.
Now, while undeniably powerful, profoundly influential, and widely praised, some critical observations have been made about the book's specific style and occasionally its scope. What are these critiques, and how do they inform a more nuanced, deeper understanding of this otherwise monumental work?
Yes, it is always essential to approach any truly influential work with a discerning and critical eye. And Dweck's mindset is certainly no exception. We need that balance. One common observation which is mentioned is that the book often employs an anecdotal style, particularly when illustrating points with high-profile figures, athletes, artists, CEOs, Critics have, quite reasonably, raised questions about Dweck's direct, first-hand knowledge of these individuals, or her reliance on what could be termed second-hand accounts. For instance, the question is posed about whether she takes everything someone like Lou Gerstner says about himself and IBM at face value from his autobiography.
So questioning the depth or objectivity of the examples.
To some extent, yes. This highlights a legitimate concern that some of the grand, sweeping examples might be overly simplified, presented without full and intricate context, or even selectively chosen to fit the narrative. While these stories are undeniably engaging and serve to illustrate the concepts vividly, they are, by their very nature, retrospective accounts, and the actual dynamics of profound change in complex organizations or within the intricate psyche of high-achieving individuals are often far messier, more ambiguous, and more convoluted than they might appear in a distilled summary. This doesn't necessarily invalidate the theory, of course, but it calls for a nuanced reading of the supporting illustrations.
Are there other critiques?
There's also a more philosophical critique mentioned that in certain modern societal contexts, motivational speech has become a good in itself, potentially leading to worrying situations where teachers, coaches, and bosses are appraised by their ability to gain results where the bar has been lowered rather than raised.
So a focus on feeling good rather than genuine effort.
Exactly. This critique subtly points to a potential misapplication, or perhaps even a dilution of the mindset concept, where the authentic emphasis shifts from genuine, arduous effort and deep, meaningful learning to simply feeling good or achieving superficial, easily demonstrable results through subtly lowered expectations. There's a very valid concern about how these powerful ideas can be misinterpreted, trivialized, or even weaponized in practice.
Right, the participation trophy
So
effect.
something like that. However, it's equally important to acknowledge that the material itself insightfully notes that while these anecdotes might sometimes appear simple and repetitive, they are, in fact, meticulously and deliberately chosen because they all work to support this theory. So while some critics might perceive the reliance on a predominantly anecdotal style as a stylistic or methodological fault, it is evidently a conscious choice by the author to provide highly relatable, accessible, and memorable illustrations for what is, at its heart, a complex and profound psychological framework. It's a strategic decision for accessibility.
That distinction is crucial. One particularly important clarification the material makes, countering potential misinterpretations, is that Mindset isn't simply another self-help book that promises quick fixes. What does that mean for its fundamental purpose, and perhaps more importantly, for its lasting impact on highly skilled professionals, particularly in the demanding and evolving field of medicine?
Yes, this is a really important clarification, often misunderstood. It speaks directly to the academic integrity and lasting value of Dweck's contribution. The material explicitly states that the book is best understood not as a fleeting self-help guide, but as a summary of a body of rigorous research in a scientific field. It is emphatically not a prescriptive guide promising instant riches or effortless success, not at all. Instead, it meticulously distills decades of empirical psychological research, much of it Dweck's own groundbreaking work, into an accessible, coherent, and powerfully actionable framework. While the core idea's effort matters, learning is continuous, abilities can grow, might not be entirely novel in the long sweep of human thought. What Dweck does brilliantly is effectively lay out the beginnings of a unified theory of how humans learn. She provides a robust, evidence-backed structure for understanding these fundamental processes.
So its value lies in the scientific framework, not quick tips.
Precisely. Its enduring value isn't in offering simplistic quick fixes, but in providing a truly powerful, empirically validated framework for understanding precisely how intrinsic and extrinsic motivations work, and how our beliefs about ability profoundly shape them. This is particularly relevant and immensely practical for those in demanding leadership, teaching, mentorship, or critical communication roles within medicine. For a chief of surgery, for instance, understanding mindset helps them to actively foster a departmental culture where learning from surgical complications is explicitly encouraged, rigorously analyzed, and genuinely embraced, rather than feared as a reason for punitive action. For a medical educator, it refines and empowers how they give feedback to students, ensuring it actively promotes growth, resilience, and a deep sense of inquiry, rather than instilling a fixed, limiting view of ability. For any clinician, understanding intrinsic motivation, as illuminated by the growth mindset, is a powerful antidote to burnout, helping to reframe relentless challenges as opportunities for profound learning and meaningful contribution.
So it's more than just inspiration.
Much more. It's not simply inspirational advice that feels good in the moment. It's a rigorously researched, evidence-backed model for understanding fundamental aspects of human behavior, learning dynamics, and the pursuit of sustained professional effectiveness, especially in an environment where even minor missteps can have significant consequences.
Despite some of the stylistic critiques we've discussed, the overwhelming sentiment from those who genuinely engage deeply with Dweck's work is its profound utility and truly transformative impact. Why does this concept resonate so strongly with so many and continue to provide such tangible value for us, particularly in navigating complex professional lives?
Well, the enduring power, the universal resonance, and the profound utility of Dweck's work lie precisely in its fundamental truth and its remarkable practical applicability across virtually all domains of human endeavor. It just rings true for so many. As the material so poignantly highlights, there's not a person I've ever met, including me, who couldn't improve their own life just by reading, understanding, and applying the ideas in this book. This power and sentiment speaks directly to the universal relevance and the actionable nature of the growth mindset. It offers a clear, elegant, and profoundly effective framework for continuous personal and professional improvement that is deeply rooted in our innate cognitive processes and the brain's capacity for adaptation. Rather than merely suggesting superficial behavioral changes, it's a conceptual shift, a profound reorientation of how we perceive ourselves and the world around us.
You mentioned some might find it too simple.
Yes, for those who are, perhaps unconsciously, deeply entrenched in a fixed mindset, the perceived simplicity of the solution, or the core insight, can sometimes, ironically, be a significant barrier to its adoption. They might genuinely think, or indeed feel, the solution is too simple for them to admit that they've been missing it their whole lives. This initial resistance often stems from the inherent psychological difficulty of acknowledging that a relatively simple shift in perspective, a mere internal reframing, could have made such a profound difference, which fundamentally challenges their deeply held, limiting beliefs about their inherent capabilities. Yet, it is precisely this powerful simplicity, once genuinely embraced and consistently applied, that makes the core concept so universally accessible, so remarkably actionable, and so endlessly applicable in real-world scenarios.
Accessible and actionable.
Exactly. It doesn't necessitate complex therapeutic interventions or years of arduous study, but rather a conscious, consistent shift in internal dialogue, external behavior, and fundamental perspective. Ultimately, the book provides robust evidence and compelling anecdotal support for the idea that a growth mindset can enrich people's lives in a multitude of ways, personally, professionally, and socially. This makes it an absolutely essential deep dive for anyone who aims to manage people, wants to profoundly understand yourself, or is involved in teaching or communicating effectively and impactfully. In the demanding medical field, this translates directly to demonstrably better, more empathetic leadership, far more effective mentorship that truly develops potential. The cultivation of more resilient and innovative healthcare teams, and ultimately individual professionals who are not only more fulfilled, but profoundly more capable of navigating the intricate, often overwhelming and ever-evolving demands of their noble and vital profession. It's a foundational, life-altering insight that empowers individuals not just to survive, but to continuously adapt, truly excel, and find profound meaning in their work.
This deep dive into Carol Dweck's mindset truly underscores the profound, often invisible distinction between believing your abilities are fixed versus understanding they are dynamic and can continuously grow. It powerfully highlights how these fundamental beliefs ripple through every single aspect of our professional and personal lives. From how we approach continuous learning and interpret unavoidable setbacks to how we lead complex teams and nurture crucial relationships that underpin patient care. For medical professionals navigating these ever present complexities, embracing a growth mindset isn't just about personal development, it's about fostering an entire culture of continuous improvement. Enhancing leadership effectiveness throughout the system, building profound resilience against inevitable challenges, and ultimately achieving a deeper sense of personal and professional fulfillment within the intricate and ever evolving landscape of healthcare. If you found this deep dive valuable, we'd be so grateful if you'd consider leaving us a rating and sharing it with a colleague who might also benefit from these powerful insights. So, as you reflect on your own approach to new clinical challenges, how you give feedback to your team, or even how you view a setback in your career, consider this. Where might a subtle yet profound shift from simply proving your existing capabilities to genuinely embracing and improving them unlock unexpected potential for you or indeed for those around you?